Recent reports state that in the prior year, in 2017, in Los Angeles County, overdose deaths because of opiates have continued to increase. So it's a continued problem that doesn't seem to be getting any better. Some new medications are being released and being tried to help with various symptoms of opiate addiction. And I'm a big advocate of anything that's going to help. Anything that's going to reduce symptoms, anything that's going to reduce withdrawal, anything that's going to reduce cravings, anything that's going to help a person just get that extra leg up when they're trying to recover from opiate addiction. And so some of the medications, there's a few different classifications. Some of them are designed to be maintenance, so coming off of long-term use of any kind of a drug like heroin or other opiates. Some people will substitute that with something like methadone. And so they get on a methadone maintenance program, sometimes for years, sometimes for months. And that's really designed to be harm reduction. So the idea is that if a person switches to methadone and can get it from a clinic and prescribed by a doctor, then they're not out on the street stealing and buying heroin and doing all the illegal things that are necessary to obtain the heroin. Then there's a classification of drugs that mostly includes things like Suboxone or Subutex, which are really a combination of different medications, one being called Buprenorphine and the other one being called Naltrexone. So those are designed for both craving and withdrawal. And so when a person comes off of an opiate, one of the biggest obstacles to them recovering is the withdrawal symptoms. Severe sickness, headaches, nausea, diarrhea, vomiting. There's a lot of different symptoms from withdrawing from an opiate. And so the buprenorphine, which is in both Subutex and Suboxone, reduces those and can actually stop altogether those withdrawal symptoms. So what a person will do is they'll come to see the doctor for those medications, stop taking the heroin or the other opiates, and start taking the Suboxone or the Subutex, and then that medication over a period of time will be reduced so that they taper off of that drug so the withdrawal symptoms aren't felt. Another medication that's used is called Naltrexone. Naltrexone is what's called an antagonist. So if a person is on Naltrexone, then what they will do is if they use an opiate, they don't get high off of it. So if you're going to take the medications, make sure that you're in an outpatient program. Make sure that you're seeing a therapist. Make sure you're going to some 12-step meetings. Whatever else you can do that's going to start to address the underlying issues, because the medications are simply for the physical symptoms, not for the emotional symptoms. And that's really at the heart of everything that addiction is the emotional symptoms.